Responding to concerns about ambulance services in the state, Health and Family Welfare Minister Dr. M. Preen Lingdaw stated that the availability of ambulances has significantly improved. Health Secretary and NHM Mission Director Ramkumar S. further informed that plans are underway to expand 108 services to more locations, including new blocks, with a new tender process set to launch soon. Additionally, the department is working on acquiring 10 new 4x4 all-terrain ambulances to ensure access to remote and challenging terrains.
The situation of availability of ambulances is much better. But at some point of time, due to some unavoidable situations, like we just gave you the Umden story, we need to categorize patients and their conditions before making these services available. 108 is also now functioning quite efficiently. We have bettered our services. So I will not have, in case sir has anything to add. Yes.
No, 108, there are 3-4 varieties of ambulances, all of you need to understand. One, PHCs themselves are ambulances. Most facilities across the state, all of them may not be very new ambulances, but at very different types of time they were being purchased. Particularly during COVID time, I think under Chief Minister's development fund, I think about 30 plus ambulances were given to different facilities. Madam had recently gone to Reward District Malna and given a 4x4, because the problem with ambulances are coming many times that there is no 4x4 ambulances in some very difficult terrain and rain period. We require a 4x4. 4x4 ambulances are not in manufacturing at all. So you have to get a 4x4 vehicle and fabricate it and do it. It's a whole different exercise we have to do. So we have already done that. 5 ambulances have already been given to the facilities, another 5 have been procured separately. But there is one facility level ambulances, which means PHC, CHR, district level ambulances, number 1. Number 2 are the Chief Minister's Safe Motherhood Scheme fleet. These are vehicles which have been tied up by the decentralized way by the facility locally, so that any pregnant woman, child who has requirement of a vehicle to transport to the hospital, to a higher facility, to a diagnostics, or back dropping them home, they can utilize it. These ambulances are, I think each facility has at least about 2 to 3, which across the state, which means about 150 facilities we have in the state, PHC, CHC, district hospitals put together. So 300 plus vehicles only on that CMSMS vehicle alone be there. Last year alone, more than 95,000 trips were made by these vehicles, 95,000 trips. So that's something, on every day we have more than almost 300 trips being made every day. And next we have 108. 108 is primarily meant for higher referral facilities or road accident cases where immediately it has to be attended there. So we have one PHC level vehicle, then CMSMS fleet for these pregnant women, children matters, and then there are ambulances like 108, which has a trained medical technician is there, and a pilot is there, which is a driver is there, and then a helper, person to help is there. That's a 108 number, and etc. All those entire system. But activating 108 in different locations is a different. It's not going to be that easily possible. As of now, we have about 45 locations across the state, but we want to increase it up to all the new blocks also which has come. So there is a new thing, the new tender which is coming up. We will definitely do this. Not only blocks. This is not exact. This is based on patient loads and where it goes. It was done for a very long time. So we have just recently a little bit increased. So it is basically we identify it as block wise, like Madam said. But for example, Shillong is not a block, but there are 3 locations within Shillong urban area. So there are urban areas, and there are facility-based areas, and there are block areas like that. We can give you the
by
details.
when are you planning to extend the facility to other
blocks? So in fact, we have the pre-bid meeting going at 6 o'clock. We have the pre-bid meeting, and I think the tender is already in the public domain. We should find a new partner, and after that, we will try to expand the number of location spaces.
Sir, you also mentioned about 4x4 ambulances. How many 4x4 ambulances we have?
As of now, we have about the recent purchase one is 5. The previous numbers I have to check that. We are trying to purchase another 10 more ambulances. This is for really remote locations, something like Raniko, etc., where it's very difficult for sometimes to go in some places. But even there, many places the roads have all come up. So, but all season vehicle is something we are looking at. So each ambulance is about purchase and fabrication is about 17-18 lakhs, which means putting in basic life support materials. So 18 into 5 is about we already spent about 80 lakhs, and we are going to spend about another 0.5 for this. But we do it in phase wherever deserving. Madam has also informed multiple times, as well as our CM also has informed multiple times that we need to ensure that these